Jiran ta pa West Jaiñtia District hakaba nangilam yang kalian persyak Dr. Mukul sangwa rengkat berkat tungut ki Emily kelawan jengok yang Jingpynkhreh Īakhun hakaba bajing persyak ya ke Jingpang COVID-19. Dr. Mukul ularung nukam haka corona care center tabala Jingpynkhreh Īakhun district ahne hapo kacata sumar hostel joki sister. Bagai kebau Dr. Mukul lalum handi bata wala kaladan handi kacata ban baik berkemi ya kiberi kiba yo Jingpang COVID-19 dari kadang dia Jingpynkhreh bat kepap biang lut ke Jingduna. Hari kata Dr. Mukul ularung ru haka community care center ke bala Jingpynkhreh daka darbas nonglat telabo. Banang neru kita don dekat Jaiñtia 4 don kiberi kibasa. Hari kali pan ularung sahaka hospital ke COVID hospital jong ke sarkar ke badai mersua ke civil hospital hani po jual. Bat Dr. Mukul haba uliakan bat ki doktor bapek yang ni ulalap bakadang don sibun ke Jingduna bat kata kabai kalong ba kita pun kam nam taka jing ai oksigen ya ki mesin dang sedang banbu bat ya ki jeng kamaro dang don hapo ka jing sina bat ka jing penbek abai kan bagi nang khobor atau Mukul sama ola penpau ba kembau ulap himaun kaliang jok saka kadang dong sibun ki Jingduna bat kembau kapau hi ka saka kadang don hapring ki jing bembet ki jing bambiang mat khamtam haka Jingpynkhreh bat jing don ya ki beriu ni ki nang frame bat pek panilep pesa ya ni ka Jingpang.
Our observation based on these and earlier inputs that we have received is that the government need to provide the necessary support to the health department. When we look at the support that has been provided are completely inadequate, and even whatever is being provided is in the process of implementation, which gives us reason to believe that the overall preparedness was completely missing, and unfortunately that has resulted in painful experience for all of us, wherein we have lost precious lives. So measures that could have prevented the number of incidents and measures that could have saved precious lives.
Dr. Mukul sang maru ola penpau habakan bikira pai kubur ba koi ni kicik ba jelak ya kendu kadi namar ba kamdon satya ya ki beriu dan ki nang trayo kakak kya ki ba train jadi ki ba penbet ulong wala kidan ba kana kor keyboard ki ventilators ki oksigen ba koi dia ki jengkan kam haki kamera ICU henrai ki beriu pat ki ban pek ki ban penekam ini kita kira duna hadu kata-kata. Bagi nak tahu lah orang bah pasakari kan hapan kendit tiak bat-bat. Ban tak rakam ni kacang sakren tu ni kacang pang. Kalau orang ru bah kibabun nak beriu kibapai hapok selong kibawan tiak ki hospital kibakai nak buat selong kibabun di nang ni pok Jaiñtia Hills. Ya kan ni ulah penpau bah peniru bakadai kajing bambiang jo jaka semar hanin hapo ka district patunjur kajing bamban ki beriu ki train yang dikira jadi kata penyelidik persyak.
While we have the oxygenated beds, and when we need to look at transferring the patients because of the severity who will require ventilator, you also have to have manpower. Now this manpower auditing has not been done properly. That's why we don't have whatever ventilators are available not being put to use. This is precisely what is happening in other districts. Talk about Garo Hills, talk about Jaiñtia Hills. We should have enough manpower. We have to send our doctors for training, particularly in view of the fact that we don't have enough anesthetists. I'm sad to see that this has not been done, but I have had an interaction. In fact, even before this, I have been talking to the director, DHS, the other senior officers. Look at the alarming number of death count on a daily basis, and look at the percentage of the death. If you're looking at the death count, it's more than 2%. Anything beyond 1% is a matter of concern. And if you look at the cause of this high death count, then we are able to also know many things which revolves around the deficiencies. And these deficiencies must be taken care of to avoid loss of precious lives.
Kalian Dr. Mukul uang bakasong ang sarkar, bakat pait namar kadang nak bor, bakadang ru, yaki, widya ki lat keneti bakan nilai persak ke Jepang. Walaupun pauru barada ke sarkar kat tristom, bakabiang ki beriu ki menteri, bakabiang ru ke Jingpynkhreh. Ini kejelah kejungi ru kalau menyanda ya kejungan kata third wave, mana kejungan ke balai, jongan ke Jingpynkhreh ke bakal penpau haki babun ki jaka ke pertai berhari India ru, baka sin ke balai ke la menawan shop biang ke Jingpynkhreh. Bakadu Dr. Mukul ulang bah nak kalian jong udum dah ya menakut dia ke jalan je parti hendai kumba ka pandemic an jaman fight yang ke Jepang kalau pun board ya we officer ini nadu ke district nadu ke sub division nak kalian jong dia kan batin dia ke board la ajung dia ki ulah kare dia ki ke beri mana ni ki baki kena kum ke board yang malam kup baki ke board ke an. Jadi kepo Dr. Mukul lapan paru mana kalian dulu dia kemudian dia kita bikin bebit panjang untuk besar di mana masyarakat panjang dia kita kam dia kam dia dan beliau baik ke bawah kemudian punya dia balak ban baik nak kemudian banyak percaya dengan Jepang.